Hi everyone, my name is Lori Clark. I'm a senior in the Organizational Leadership bachelor's degree. I am completing my business presentation on for my healthcare management degree, or healthcare management class, sorry, on Remote Area Medical. Remote Area Medical is a charitable organization that, you may recognize from our book. It was highlighted in Chapter 6. They provide completely free medical care to rural and underserved communities in the U.S. and worldwide. I chose Remote Area Medical for a variety of reasons. My sister introduced this to me a few years ago, and we discussed their mission and how we could help to further it. Because I'm closer to the end of my career than the beginning, I wanted to highlight an organization that I would hope to work for throughout my working years and then afterwards as well. I felt that with my 30 plus years of healthcare experience, that I could use my experience to help those less fortunate than myself, and use my management experience that I currently have to help the organization itself. The founding of this organization has a very interesting story. It was founded by Stan Brock, pictured here. He was a actor and explorer. Most of you probably do not know, but he was actually on Mutual of Omaha's Wild Kingdom, which was probably in the 70s. I'm sure you wouldn't remember that, but he was exploring in Guyana, South America, found himself injured and was unable to get to any medical care. It was a 26-day journey for him. And because of this, he vowed that he would start an organization that would provide care for people who could not get to it or could not afford it. He started this in 1985. It is headquartered in Rockford, Tennessee, and also affiliated with Virginia Free Mobile Health Services, a form of RAM in Virginia. Stan is so committed to his mission that he does not even collect a salary. He lives in a schoolhouse that they rent from the city, I think, of Knoxville, Tennessee, for $1 a year, and just everything that he does goes to Remote Area Medical. The 3 core values that drive this mission are what speak to me. The compassion that the volunteers show. They truly dedicate themselves to transforming communities and that they serve. Sorry, it's a little too fast. The integrity. RAM is dedicated to their patients by upholding the highest standards of care and utilizing the best resources available to them, both volunteers and medical equipment, to help prevent pain and alleviate suffering. And the respect. The volunteers, staff there hold all persons in each community with the utmost respect. I feel these core values embody the spirit of all dedicated medical professionals, and show how they approach their careers, and feel that with those core values in mind, that will advance the lives of the people that are served by Remote Area Medical. RAM's mission is to provide quality health care that's free of charge for those in need. Their vision is to be the very best at delivering care through efficient and quality measures. And their philosophy is to, help as part of a larger effort. Apologize for that. To bring people together to improve their lives, improve their communities, and work towards a better and healthier future. RAM is classified as a nonprofit charity. It has a 503c designation by the IRS. It is a tax-exempt organization, which means it is eligible to receive donations as charity. They totally rely on donations for their funding. They do not receive federal funding, and the services and the equipment are totally donated, entirely volunteer organization, and all donations are made through through the donors for medical supplies, etc. According to give.org, which is a Better Business Bureau Wise Giving Alliance website, RAM has the total net assets of $11,400,000+. Their income in 2015 was $5 million. Their expenses were over $4.6 million, and the donations they received were over $4.4 million. RAM's organizational setup is that they are run by a 12-person board. It is made up of 6 physicians, 6 business persons. They have a total of 18 paid staff members and many, many more that are volunteers that aren't paid. Their fundraising methods are direct mail, print, advertising, some television, but not a great deal. I think the most impressive statistic that I found was that the fundraising costs for RAM are total only 5% of the contributions that they receive. Looking at this, you might not be impressed, but if you dig a little bit further down, we note that 50 of the top charities have an efficiency rating. In their efficiency ratings, average about a 9% cost for fundraising. So RAM is almost half of what the top 50 charities are in their fundraising costs, and that means more of the donations go directly to charity, which is amazing. RAM provides care through weekend clinics. They offer medical, dental, vision, and veterinary care. They average about 20 clinics per year. Most of those clinics, a little over 60%, are clinics that are held in the United States, and they do have some that are held overseas, mostly in Guyana, where in South America, where he had his incident. Some in the Philippines, in India as well. But a majority of the U.S. clinics are held in the Appalachia area, eastern Tennessee, Virginia, West Virginia, those areas where there's a large rural population that are in need of care. RAM is also involved in disaster recovery. They utilize their units and aircraft to help other agencies during disasters. They also are there to provide follow-up care in disaster zones when the first responders are ready to leave. You also note that I did mention that they do provide veterinary care. They feel that they're caring for families, and so animals are part of the family. Their care is expensive, and they feel that they should go ahead and care for them as well as part of the whole family. The article that I chose to look at and explore was an article written by Aaron Carroll in the New York Times just about 4 months ago, maybe 6. It is Why the U.S. Still Trails Many Wealthy Nations in Access to Health Care. It discusses the Affordable Care Act and talks about the main premise for the Affordable Care Act, which was to reduce the number of uninsured people and to increase access to care for those people as well. They did this by expanding the safety net of Medicaid, regulating the non-employer-based private insurance market, and offering subsidies to qualifying individuals to assure affordable coverage. In doing so, they did increase the number of insured people in the United States. However, there has been little change in access to care. With more people insured, there's more people looking for care, and there has not been an increase in the number of physicians that are available to help care for those people. Obviously, it's probably gotten much worse. The research that was completed by the Commonwealth Fund has shown that the U.S. falls well short of their access to care and availability of urgent or after-hours appointments compared to similar higher-end socioeconomic countries around the world. The access to care is limited by by two main factors, really. One is manpower. The U.S. has fewer general practitioners per capita than any other country in the U.S. or in the world. We have about half as many per 1,000 people as the next closest country, which would be Sweden. And the majority of those the majority of communities that are lacking primary care providers, or PCPs, are in rural communities in the United States, rural areas. Hence the popularity of remote area medical clinics that occur on a weekend, and they are just overwhelmed with patients that need care or looking for care at those clinics. There's also a large expense in obtaining health care. Even those that have insurance tend to forego care because of the expense that they have in paying for their health care. That is, the Commonwealth Fund found that more people that actually do have insurance tend to forego getting care because they can't afford the deductibles, the co-pays, the co-insurance, all of those things that come into play with getting care. The article highlights problems with healthcare that RAM attempts to fix. It which is obviously lack of affordable health care. Our text discusses a lot of the, the problems that are highlighted in the article, and within the or that RAM is working towards improving. It explains that if you look at the picture here, it shows the iron triangle of healthcare. It is a balance of quality, cost, and access. These three components must be in balance to have efficient and successful quality healthcare. I feel that the U.S. system is definitely has a disparity between the high costs of healthcare and the lack of access, or the deficiency in access to care. And this is one of the things that obviously RAM, the mobile clinics, work to resolve. Is they have free healthcare, which is high quality and definitely affordable, although they still struggle with improving access because they have a limited amount of time and volunteers and equipment, monies in order to care for all the people that need it. Also, Chapter 3 in our text, which is Basics of the U.S. Healthcare System, discusses the statistics behind various healthcare systems worldwide. It talks about a shortage of primary care physicians in the U.S., especially in rural areas, which was highlighted in the article as well. The statistic from our textbook says there are about 25 physicians per 10,000 people in the U.S., which is a much lower ratio than most other countries that the text reviewed. The U.S. also ranks high in its expenditures for healthcare spending. Upwards of 17.6% of the GDP is spent on healthcare. Obviously, if you have, and which is the highest of all of the countries that were assessed by our textbook. If you have that much spending, you would assume that we would have the best healthcare, we would have a very healthy population, but that is not necessarily the case. There's not a direct correlation or direct relationship between the health of the population and the amount of healthcare expenses that the U.S. has. There's also this is highlighted by the problems that RAM tried to resolve, and it is one of the reasons why their clinics are so overwhelmed with patients that they can't take care of all of them in the weekends that they have their clinics. Chapter 6 also discusses, which I spoke of earlier, actually highlights Remote Area Medical, or RAM, and their mission, which is to provide affordable care to rural and underserved communities. Again, it talks about 60% of their services provided in the U.S. It also talks about how efficient their clinics are. They roll into town early on a Saturday morning. The doors open around 7 a.m. Volunteers are there about 5 a.m. They set up in usually, it could be fairgrounds, it could be schools, convention centers. any place that they can get a large area where they can move as many people through as that their volunteers can do. And they work through Saturday, back at it again Sunday, and obviously have to tear down about 2 o'clock on Sunday afternoon so that they can get their equipment and volunteers back to their regular jobs. And so it is hard to turn people away. If you can imagine having to turn people that have no other option away. There are some potential problems that I feel that may arise with remote area medical. Because they rely solely on donations from the public, they could lack funds to continue their mission. They, if they have a down year, that decreases the amount of clinics that they can provide, and also, even if fundraising doesn't decrease, there's obviously an increased need more and more for people that people have for affordable health care. So that is a problem for them. Another issue I found could be lack of volunteers to adequately staff their weekend clinics. The concern arises because there is a shortage of nurses and physicians, and I'm sure other healthcare professionals. And with this, they could run into the fact that people don't have time to get off of work to actually do this, even though they are weekend clinics. Obviously, nurses and doctors don't work 9 to 5 Monday through Friday, so that could be another potential problem that I see. Increased costs associated with aging equipment and the purchase of new equipment. I feel that even though their equipment, or most of their supplies and equipment, are donated, they may run into the fact that their equipment breaks, they need something new, and obviously we know medical equipment is costly, and it would be quite expensive for them to dig into their budget, and obviously that would decrease the number of clinics that they could hold if they had to use donations to go towards equipment or supplies. Another issue I see would be increased costs associated with administration and fundraising efforts. Right now their costs remain extremely low, which is wonderful because the majority of their fundraising goes to the patients that they're seeking to help. But those costs may increase over time. Hopefully they have a good cap on those costs, and that won't occur. But in order to obtain more donations, fundraising efforts have to occur, and so that could definitely increase. The other thing I would be concerned about would be the lack of donated equipment or supplies that they use to run clinics. This, I don't know exactly where they get all their supplies from. I'm sure some of the major medical supply places like McKesson may be donors for them, but if that tends to dry up, economies aren't doing as well, that could be definitely be a difficulty for them. There are a number of questions that I would like to pose to Mr. Brock. Were I to be recruited for employment there, or just volunteering, which is actually my goal more so than being employed there. One, how do you recruit volunteers? How do you get your message out to people? I haven't noted that haven't seen much besides your website and um, your magazine that actually promotes volunteerism with your organization. So that would be, how do you get your message out? Also, with the shortage of physicians and RNs, as I highlighted in my potential problems, what impact has that had on your ability to draw volunteers to your organization? That would be a concern. Obviously, there's a large shortage of nurses and physicians. I'm not sure if the same holds true for the dental hygienists and dentists that are involved, the ophthalmologists as well, or the veterinarians. Those are the 4 areas that they really highlight in their clinics. But that would be a concern of mine. I would ask about their typical fundraising model. We did talk about how they do fundraising: direct mail, print, television. I personally, except for what my sister had shared with me, had not ever seen anything about remote area medical. I think that the organization has a phenomenal business model. Their mission is unbelievable, and I really feel that if they could get their message out, more and more people would appreciate that, donate, and also volunteer. So that would be if and do they target specific areas for fundraising? Do they target the areas closer to where they have their clinics in the U.S.? Another question I had would be about how they budget yearly for replacing aging equipment, and if they schedule that. That can always be a difficulty in determining when to repair or when to replace your equipment. And if that equipment isn't donated, they obviously need to replace it by paying for it. So that would be a large hit on a budget that they rely strictly on donations for. So interesting. I wondered also if they had specific relationships with medical supply companies to purchase or obtain their donated supplies. Obviously, they don't make those public, but that would be a question that I had, as to how can we improve relationships with different supply companies to increase the amount of donations that they receive. Also, I would ask about when they plan to increase the number of clinics that they hold each year. What is their limiting factor in holding these clinics? And how do they determine the location, the number or the location of clinics held? Obviously, volunteers have to have a large part in determining where and when, how often. The budget obviously does, but are there other limiting factors that they've found that could be improved upon in order to get more clinics, more volunteers, etc., to help more people? Also, how do you determine the areas that have the greatest need for your clinics? I did read that they have focused a lot on Tennessee because they do have a law that states that volunteer physicians can come in and work in the state even though they don't have a medical license in that state. So that is, I think, one of the reasons why they largely do a lot of clinics in Tennessee and in that surrounding area. They discussed that there are about 12 states in the U.S. with similar laws, and I think that is probably a difficulty for them because it is what limits them and the physicians, the volunteers that come in from practicing and helping these people. The mission that RAM obviously is to provide quality health care to those in need that are, and they are successful. You can look at the pictures that I've included. People line up for hours and hours ahead of time in order to be part of these clinics, and unfortunately they may have to turn a number of them away at the end of the weekend due to time or lack of resources, and I know that that is a difficulty for them. If you're interested in learning a little bit more about remote area medical, I have some web links that are available to see how they work. The first one is a short film that they created to show what they do at a RAM clinic on a weekend. The second one is obviously the Remote Area Medical US website. It gives many statistics about how to donate, how to volunteer, what they do, what their mission is. They are more than happy to share any pictures that they have in order to promote their organization. Also on that website there is a 60-minute segment that aired a number of years ago, but still very relevant, which was very interesting as well. So feel free to take a look at that. I also have my work cited. I think. There you go. Sorry. I have my work cited here that I used. So if you're interested in finding out more, reading the article that I looked at, feel free. If you have any questions, please email me. I appreciate your time, and thank you for your attention today, and have a good evening.